Diabetes sends out 15 silent signs at night that everyone should be aware of. Sleep isn't just for rest, it reflects your overall health. Unusual nighttime symptoms are your body's way of revealing its hidden secrets. Did you know that diabetes doesn't announce itself loudly? It's like an underground river, quietly flowing beneath the surface of your body. Those nighttime symptoms are the first ripples signaling trouble before the flow turns into a raging flood. In this video, we'll uncover the 15 subtle signs that show up each night, warning that something might be off, with diabetes as the likely culprit. Watch until the end to recognize all the symptoms and get practical advice to completely transform how you manage diabetes. Let's dive in. Number 1, night sweats, a silent storm sending mysterious signals. When you fall asleep, your body is supposed to be in a state of relaxation and regulation. However, if you wake up in the middle of the night drenched in sweat, it's not a random phenomenon. It could reflect that your blood sugar levels are dropping too low. In such cases, adrenaline is released to try to elevate blood sugar levels. This process increases your heart rate and activates your sweat glands, leading to abnormal sweating. Additionally, this phenomenon might be related to nerve complications caused by diabetes. Nerves controlling sweat glands can become damaged, causing this system to malfunction. If you often experience night sweats, start by monitoring potential underlying factors. First, check your blood sugar levels before bedtime. According to research, stable blood sugar levels in the evening should range from 90 to 130 mg/dl. Second, add a light snack before bed featuring low glycemic index (G) foods. For instance, a slice of whole grain bread with a touch of peanut butter. Moreover, ensure your sleeping environment is ideal, with room temperatures kept between 64 to 70 degrees Fahrenheit, 18 to 21 degrees Celsius, to minimize excessive body temperature regulation. Lastly, consult a healthcare professional if this condition persists. A doctor may recommend an HbA1c test to evaluate your average blood sugar levels over 3 months or assess nerve function for potential diabetic complications. Number 2, leg cramps, a sharp pinch interrupting your sleep. The sudden, painful spasms often stem from an electrolyte imbalance, specifically a deficiency in essential minerals like potassium, magnesium, or calcium, elements that diabetes can disrupt. Another cause is peripheral neuropathy, a common complication of diabetes. When the nerves in your legs are damaged, they may send incorrect signals to the muscles, triggering uncontrolled cramps. This not only causes discomfort but also severely disrupts your sleep. Leg cramps can also result from poor blood circulation, a common issue in people with diabetes. When arteries fail to deliver enough oxygen-rich blood to the legs, the muscles may respond with intense contractions, especially at night when the body is inactive. To reduce the risk of leg cramps, make sure to include sufficient essential minerals in your daily diet. Add potassium-rich foods like bananas, sweet potatoes, or avocados, and boost magnesium intake through leafy greens, nuts, or whole grains. Before bedtime, perform a few calf stretching exercises to enhance blood circulation. One simple exercise is to stand about a foot, 30 centimeters, away from a wall, place your hands on it, and lean forward to stretch your calf muscles. If cramps occur frequently, check your blood sugar levels and consult a doctor to evaluate nerve or vascular function. Number 3, restless leg syndrome, RLS, the endless dance of the legs. This condition is characterized by an irresistible urge to move your legs, often occurring in the evening or at night. Research shows that RLS is closely linked to peripheral neuropathy, a common complication of diabetes. When nerves in the legs are damaged, they can produce sensations like tingling, prickling, or uncontrollable restlessness. This leads to discomfort and significantly disrupts sleep quality, trapping you in a cycle of fatigue. Additionally, RLS is associated with an imbalance of dopamine in the brain, a chemical that regulates muscle movement. Diabetes, by disrupting metabolic processes, can indirectly affect the production and use of dopamine in the body. If you frequently experience restless sensations in your legs, the first step is to make lifestyle adjustments. Engage in light exercises like walking or stretching your leg muscles before bedtime to relieve nerve tension and improve blood circulation. Increase your intake of iron and magnesium through your diet, as deficiencies in these minerals are often linked to RLS. Foods like leafy greens, cashews, and oats are excellent choices to help alleviate this condition. Additionally, avoid stimulants such as caffeine or nicotine in the evening, as they can exacerbate restlessness. Number 4, sleep apnea, a disruption of life's breath. Sleep apnea is not just moments of gasping for air during sleep. It's a condition where airflow to the lungs is temporarily blocked, putting the body into a state of oxygen deprivation. For individuals with diabetes or at risk, sleep apnea is more than an isolated event, it's a factor that can worsen overall health. When the body lacks oxygen, the brain sends emergency signals to wake you up and restart breathing. This leads to repeated sleep interruptions throughout the night, increasing the risk of blood sugar imbalances. Furthermore, sleep apnea is associated with increased insulin resistance, making diabetes harder to manage. This condition can also strain the cardiovascular system, raising the risk of high blood pressure and severe complications such as strokes. For those with diabetes, this dangerous combination makes disease management even more complex. So, what should you do? First, monitor symptoms of sleep apnea, such as loud snoring, sudden awakenings, or a sensation of choking during the night. Lifestyle improvements are also crucial. Lose weight if you are overweight, as excess fat around the neck can compress the airway. Additionally, avoid alcohol or sedatives in the evening, as they can overly relax the airway muscles, increasing the risk of apnea. Number 5, frequent nighttime urination, nocturia, the endless journey to the bathroom. This shouldn't be just a random occurrence. When blood sugar levels rise, the kidneys must work overtime to filter and eliminate excess glucose through urine. This process causes you to urinate more frequently, even at night. As a result, you not only feel fatigued but also face the risk of electrolyte imbalances and dehydration. Moreover, nocturia can be linked to other issues, such as kidney dysfunction, an often seen complication of diabetes. When the kidneys are damaged, their ability to concentrate urine decreases, leading to more frequent trips to the bathroom. The ultimate consequence is the disruption of your natural sleep cycle, causing prolonged sleep deprivation that affects both your overall health and your ability to manage blood sugar levels. To reduce nocturia, start by controlling your water intake in the evening. Drink more water during the day and limit your intake 2 to 3 hours before bed to reduce pressure on the bladder. Additionally, avoid caffeine and alcohol in the evening, as they have diuretic effects and can worsen nocturia. If the symptoms persist or become severe, consult a doctor to assess kidney function or evaluate the bladder to determine the specific cause. Number 6, excessive thirst, an unquenchable urge. Thirst is the body's way of signaling that it needs more water to maintain balance. However, when you constantly feel thirsty, especially at night, it's an early sign of high blood sugar levels. When the kidneys are forced to work continuously to filter and eliminate excess sugar through urine, it leads to more frequent urination, as mentioned earlier, and causes the body to lose water quickly, triggering constant thirst. Excessive thirst, if left unchecked, can lead to electrolyte imbalances and worsen other symptoms. Furthermore, it can be linked to chronic dehydration or the onset of type 2 diabetes. This is the body's attempt to maintain balance between blood sugar and water, but if the feeling persists, it can place significant strain on the kidneys and circulatory system. First, ensure that you're getting enough water throughout the day by drinking regularly, but avoid drinking too much at once. A good strategy is to spread your water intake throughout the day to maintain balance. If you notice thirst alongside symptoms like dry mouth, frequent urination, or fatigue, consult a doctor to adjust your diet, medications, or lifestyle to better manage the condition. Number 7, pain or numbness in the legs, peripheral neuropathy, a silent electric shock. Pain or numbness in the legs, especially sensations like tingling, burning, or a loss of feeling, is often not random. It could be a sign of peripheral neuropathy, a common complication for those with diabetes. When blood sugar levels remain high for extended periods, the peripheral nerves, particularly those in the legs and feet, are damaged by excess sugar disrupting nerve function. Symptoms typically occur at night when your body is resting, but the nerves are sending abnormal signals. Loss of feeling in the legs makes you more vulnerable to injury or infection without realizing it, leading to severe complications like foot ulcers and, in extreme cases, the risk of amputation. Additionally, pain or numbness in the legs disrupts your sleep. What you need to do is stay more active. Engage in light exercises like walking or yoga to improve blood circulation to your limbs. Don't forget to take care of your feet daily. Inspect your feet for early signs of cuts, blisters, or infections. Wear well-fitting, soft shoes to protect your feet from injury. Number 8. Nighttime hypoglycemia, the silent intruder in the night. This phenomenon occurs when blood sugar levels drop below normal while you're asleep. When blood sugar levels fall too low, the body activates protective mechanisms by releasing adrenaline and other hormones. This leads to symptoms such as sweating, rapid heartbeat, trembling, or even suddenly waking up feeling panicked. If not detected and managed in time, nighttime hypoglycemia can lead to serious complications like seizures, loss of consciousness, or, in rare cases, coma. To prevent this, monitor and record your blood sugar levels before going to bed. Ensure that your blood sugar falls within a safe range, between 90 to 130 mg/dl. If your blood sugar is lower, consider adding a light snack with protein or complex carbohydrates, like a slice of whole grain bread with cheese. Also, check and adjust your insulin dose or oral diabetes medication as needed, under your doctor's guidance, to avoid a dose that's too high, which could cause hypoglycemia at night. Additionally, use a continuous glucose monitor, CGM, to detect low blood sugar while sleeping. This device can send alerts when your blood sugar drops to dangerous levels, allowing you to take action in time. Number 9. Insomnia, the battle with the night. Insomnia is not just tossing and turning in bed each night. One common cause is blood sugar instability. When blood sugar levels rise too high or drop too low during the night, the body reacts by releasing stress hormones like adrenaline, making you alert and preventing you from falling back asleep. Moreover, insomnia is linked to insulin resistance. When sleep is repeatedly interrupted, the body produces more cortisol, a hormone that raises blood sugar and reduces the effectiveness of insulin. This creates a dangerous loop between poor sleep and uncontrolled diabetes. To improve your sleep, start by maintaining a regular sleep schedule. Going to bed and waking up at the same time each day helps your body establish a stable circadian rhythm. Check and manage your blood sugar before bedtime to ensure it's within a safe range. A light snack containing complex carbohydrates, like whole grains or chia seeds, can help keep your blood sugar stable overnight. Also, avoid using electronic devices at least an hour before bed. If the problem persists, you may need to undergo sleep function tests or consider therapies like melatonin supplements or improving your lifestyle habits. Number 10. Acid reflux, the smoldering flame in the night. Gastroesophageal reflux disease, GERD, is a condition where stomach acid flows back into the esophagus, causing a burning sensation in the chest, discomfort, and often occurs at night. One of the main causes of reflux in people with diabetes is autonomic neuropathy, a common complication. This condition reduces the ability of the stomach to contract and empty, causing food to stay longer, increasing pressure on the lower esophageal sphincter and leading to reflux. When the digestive system is disrupted, the absorption of sugar and diabetes medications is also affected, increasing the risk of blood sugar fluctuations. To reduce this phenomenon, start by adjusting your diet. Avoid foods that trigger reflux, such as fatty foods, spicy foods, chocolate, caffeine, and alcohol, especially in the evening. Instead, opt for lighter meals that are high in fiber, and eat at least 2 to 3 hours before going to bed. When sleeping, elevate the head of your bed by about 15 to 20 centimeters, and lying on your left side can help reduce reflux symptoms due to the natural structure of the stomach and esophagus. Maintaining a healthy weight is also crucial, as excess weight increases pressure on the lower esophageal sphincter. If symptoms persist or worsen, you may need medications like proton pump inhibitors, PPIs, or undergo a gastric function test to rule out other issues. Number 11. Nightmares or vivid dreams, the horror movies of the mind. Nightmares or vivid dreams that are so intense they wake you up suddenly. When blood sugar drops too low or rises too high during the night, the brain gets overstimulated and puts your body into a state of stress. This can lead to dramatic dreams, such as running away, facing danger, or feeling extreme fear. Additionally, vivid dreams can sometimes be a sign of a sleep disorder related to diabetes, such as sleep apnea, which deprives the brain of oxygen and triggers stress responses throughout the night. To minimize this, start by establishing a relaxing bedtime routine, such as reading a book, meditating, or listening to calming music, to reduce stress and prepare your brain for deep sleep. Limit stimulants like caffeine or alcoholic drinks in the evening. If the issue becomes more severe, consult with your doctor. They may suggest sleep function tests or assess the impact of diabetes medications to make appropriate adjustments. Number 12. High blood pressure in the middle of the night, the silent thief in the night. Typically, blood pressure drops slightly while sleeping to allow the body to rest and regenerate. However, if blood pressure remains high or even increases during the night, it indicates an imbalance in the body's regulatory mechanisms. In people with diabetes, this condition is often linked to damage to the autonomic nervous system, the system that controls vital functions like heart rate and blood pressure. Additionally, high blood pressure in the middle of the night can be caused by an increase in stress hormones like adrenaline, which is often triggered when blood sugar drops too low, hypoglycemia, or spikes suddenly during the night. These fluctuations not only increase pressure on the cardiovascular system but also disrupt sleep, causing fatigue and deteriorating overall health. High blood pressure at night is also a significant risk factor for complications like stroke, heart attack, or kidney failure, especially when combined with diabetes. To minimize this condition, first, monitor your blood pressure at night if you suspect issues, using an automatic blood pressure monitor that stores data. This helps you and your doctor track blood pressure fluctuations accurately. Reduce salt intake and avoid processed foods at dinner, as they can increase blood pressure. Additionally, steer clear of caffeine or stimulants before bed, as they can increase heart rate and blood pressure. Number 13. Palpitations, the unusual drums in the chest, palpitations, or the sensation of a fast, strong, or irregular heartbeat, often occur at night and can cause you to wake up suddenly. For people with diabetes or at risk, this phenomenon is not simply due to stress or fatigue, it may be linked to abnormalities in blood sugar levels and the cardiovascular system. Additionally, palpitations can be a sign of an electrolyte imbalance, a common condition in those with diabetes. An imbalance of minerals such as potassium, sodium, or magnesium can cause the heart to beat irregularly, leading to this sensation. Furthermore, palpitations at night may also reflect issues related to high blood pressure or cardiovascular disease, which are common complications of diabetes. To minimize and manage palpitations, start by checking your blood sugar levels before bed to ensure they are stable. If blood sugar is low, having a light snack with protein or complex carbohydrates, such as a slice of whole grain bread with peanut butter, can help maintain stability throughout the night. Increase the intake of essential minerals like magnesium and potassium in your diet. Foods like bananas, almonds, or leafy greens not only support cardiovascular health but also help improve electrolyte balance. Number 14. Teeth grinding, the squeaking sound in the darkness. Teeth grinding, or bruxism, often occurs at night and can leave you waking up with jaw pain, headaches, or general fatigue. One of the main causes of teeth grinding is blood sugar imbalance. When blood sugar drops too low at night, the body activates a stress response, releasing adrenaline, which leads to muscle tension and the uncontrollable habit of grinding teeth. Additionally, bruxism can reflect autonomic neuropathy, a common complication of diabetes. This condition increases sensitivity in the jaw muscles, causing them to tighten more intensely while you sleep. To minimize this phenomenon, it is important to establish a relaxation routine before bed to reduce stress and soothe the jaw muscles. Deep breathing exercises, meditation, or applying a warm compress around the jaw area can help relax the muscles and limit teeth grinding. Don't forget to check and protect your oral health. Using a night guard can reduce the impact of teeth grinding on your teeth and jaw joints. Number 15. Morning headaches, the painful morning greeting. When blood sugar drops too low, the brain is not supplied with enough energy, leading to headaches in the morning. This is often accompanied by other symptoms such as fatigue, sweating, or a feeling of shakiness. Additionally, morning headaches can be linked to sleep apnea, a common sleep disorder in people with diabetes. When the airway is interrupted, the oxygen supply to the brain is reduced, causing headaches and fatigue upon waking. Furthermore, dehydration or electrolyte imbalances during the night, which often occur due to frequent urination in diabetes, are also common causes of early morning headaches. To reduce morning headaches, create an ideal sleeping environment to minimize the risk of sleep apnea. Keep the bedroom cool and quiet, and avoid stimulants like alcohol or sedatives before bed. Drink enough water throughout the day and limit excessive fluid intake in the evening to reduce the risk of dehydration. If you frequently experience electrolyte imbalances, include foods rich in potassium and magnesium, such as bananas or leafy greens, which can help improve this condition.